And welcome to Healthcare Sucks. Hey guys, I've been trying to shoot you as much as I can keep up with it. It's just roll. There's so much going on. I'm gonna shoot this one, and then I'm gonna try to dig deeper and try to get us some actual interviews with some people. If I can go through Facebook and some of the other apps, I'll look through some of those, Twitter tonight, and I'll see if I can get some stuff from private parties. It'd be kind of interesting to see. I've done some of that, but there's just not enough of it getting out anymore. They've buckled it down and locked it down. So with that being said, let's see what we can do for this video.
1 week after these drastic measures were introduced, the numbers of infected still keep climbing up. People are anxious. They prefer to stay at home and not to go out on the streets or wear a mask when they go out on the streets. This here is a major tourist destination. Usually this area is quite busy with people walking around, having snacks, sightseeing. Now people prefer staying at home. Nobody really knows whether the measures the government has taken will be able to contain the virus, so people are taking their own measures of precaution, and that means minimizing social contact as much as they can.
Elsewhere, a lack of basic necessities and information are eroding confidence in the authorities. In Hong Kong, people have been queuing since 2 a.m, hoping to buy face masks.
The Hong Kong government should do like Macau's and say every resident can only buy 10 pieces. That way, every single Hong Kong person could have a face mask to wear, right?
Declared the coronavirus outbreak in China a global health emergency. At least 170 people have now died and almost 8,000 have been infected. In the next hour, a chartered flight will evacuate 150 Britons from Wuhan, the city at the centre of the outbreak. They'll land back in the UK tomorrow morning and will be taken straight to an NHS site in northwest England and kept in isolation there for 14 days. China has now effectively quarantined more than 50 million people in Wuhan and its surrounding province. The virus has now spread to every region in China. Cases of the virus have now been confirmed in 19 other countries, including Australia, America, Japan, India, as well as Germany and France. And tonight, Italy has confirmed its first 2 cases. So far, there have been no confirmed cases in the UK. From Beijing, John Sudworth reports.
Wuhan's medics are locked in a daily battle against this epidemic, with infections still rising steeply. But for trapped British residents, at last a way out.
Yeah, it's a massive relief. Can't wait to get back now and just sort of get away from everything and de-stress, I think.
From the rendezvous point at a motorway toll booth, those travelling face multiple health screenings, a bus ride to the airport, then wait for the flight. But for some, there's been serious confusion, especially mixed nationality families like Adam Bridgman, his Chinese wife Sue, and their newborn son Austin, with the UK authorities unable to say if they can get on the flight.
They couldn't tell me whether or not my wife or my son would be allowed on the plane. They said that's a matter for the Chinese authorities, and the Chinese authorities would decide on a case-by-case basis.
So that leaves you still stranded in Wuhan. What does it mean for the baby?
The main worry is medical care. If he gets sick, then we're in trouble.
We've heard from at least one other family in a similar predicament, unable to board the plane. But the confusion seems odd. After we sent our own questions to the Chinese Foreign Ministry, we received this fax saying that Chinese nationals would be able to accompany their British family members on the flight. We've passed the information on to the UK authorities. In Wuhan, 2 large, brand new hospitals are being built in little more than a week. But existing hospitals are publishing desperate appeals for medical supplies, and fear is spreading. This unverified video shows a family from Wuhan living elsewhere in China, having their door sealed shut.
Tell me that wouldn't be scary, guys, having your door sealed. On the other hand, having, a Chinese wife situation, newborn baby, being told you couldn't go, well, They said they could. We'll see if that family gets home. I'll try to keep up on that because that's messed up. And they said there's another family too. I mean, this thing's just getting carried away, my friends. I mean, pray for these people, man. Pray for ourselves too. May we all have the armor, the shields of the Lord, O Heavenly Father, of Jesus Christ our Savior, spread among my friends and family and my watchers, and bless them and protect them. And we're going to watch a little bit more of this.
Remarkably, some criticism of the authorities is being allowed to go uncensored. This doctor lambasts what he calls communists who love to shout out slogans.
I'm Natalie, and this is Jamie.
Natalie Francis is British, but her son has a Chinese passport. Shortly after we received our fax, they got a call from UK officials.
They called us about 20 minutes ago and said that there's a good guarantee that they will allow Jamie on the plane.
In a chaotic race to get out, relief for those who make it, further anguish and uncertainty for those who don't. Sophie, as well as the 150 Britons, we're told there's space on board for 50 people from other European countries. It's due to take off in the next hour or so, and when it does, there will undoubtedly be a huge sense of relief. But for those left behind, they find themselves in a city in the grip of an escalating crisis, an increasing number of infections and an increasing number of deaths. And they have no choice but to batten down the hatches and stay indoors to stay safe for as long as it takes.
John Sudworth in Beijing, thank you. Well, here the risk level has been raised from low to moderate by the UK's chief medical officers after the World Health Organization declared the coronavirus outbreak a global public health emergency. Here's our medical correspondent, Fergus Walsh.
It takes just one international flight to carry the China coronavirus around the world. That's why airports like this one in Dakar's Senegal are attempting to screen passengers. It's the fear of what the virus could do in poorer countries that's prompted the World Health Organization to act.
That's the first time that they've come out and said things like that. China talking about their own government. Man, they're lucky if they don't get shot for that one. You know how that goes. Then the next one about the people talking about it only takes one jet. 12 monkeys. One jet, one area. Bam. One airport. 12 monkeys. Bam. You know? With that, I'm going to keep hammering this till I hear somebody from up above do something serious about this or make some at least warnings. You know, we already know it's out there. We already know. We're just lucky there isn't more cases. And I want to tell you, some people are not going to the hospital. Some people are hiding out. If you escape China, you're probably hiding out until you get so damn sick you have to go. Now, the people in China, that's a different thing. But the people that escaped, and until they're so sick they can't, or they feel like they're going to pass away, then they'll go. But there's people that won't go that are carriers, guys, that may not even get the symptoms but may be passing it. Like we said, 5 days on items, 2 weeks incubation on this stuff. You know, it's scary. It's scary stuff. And, one foul, bad move, this could be biblical. You know, we could be looking at the stand type situation. That'd basically be it. Now, I don't think we're going to get to that point because we're pretty educated. Plus, the powers to be don't want to let it dwindle down to just a few people. You know, they don't want that. I mean, heck, they'd have to go to work at some point or do something. I mean, the elites definitely would never want to have to lift a finger. I mean, that's why they have paid people, paid slaves. Like you and I, we pay taxes. So they can all waste money and do stupid things and talk about the stupid, no matter which side of this you're on with the president. The peachy thing It's ridiculous. We've got this going on, and they're talking about stupid stuff. I mean, this should be, you know, guilty or not. Whichever way this is going to go down, whichever side of the fence you're on, this is more important, guys. And remember, we are the 99%. I'm going to let you watch a little bit more. This is different stuff than we've been seeing. It's different stuff than if you're watching 5 channels out there, you ain't going to see this.
The main reason for this declaration is not because of what is happening in
You see
China,
this, you'll get this part.
because of what is happening in other countries. Our greatest concern is the potential for the virus to spread to countries with weaker health systems.
The World Health Organization defines a public health emergency of international concern as an extraordinary event which requires a coordinated international response. In the past 20 years, it's been declared 5 times for the swine flu pandemic, polio, 2 Ebola outbreaks, and the Zika virus. This allows the WHO to make recommendations on how to control the global spread of the virus related to travel, such as screening at airports, boosts resources for containing the virus and spending on research into treatments and vaccines. BBC News was given access to these labs in San Diego, California, where scientists are racing to develop a vaccine to protect people from infection.
You're not seeing this on regular news. None of that. At least, I mean, you see that one guy, yeah, this is what we're doing. We're finally getting off our butts. And we're saying that it's an epidemic and it's getting serious and blah, blah, blah. Of course they are at this point. They have no choice. But this, in the lab in San Diego, excuse me, got a nose itch, guys. Remember, you're not supposed to touch your eyes and put fingers in your mouth and all that. If it gets bad, disclaimer, don't be doing all that.
Usually that process takes years, but that could be reduced to just months, according to a British scientist, after China shared the genetic code of the virus.
Months. When they're not making billions of dollars and it's looking serious, just like building that hospital, that's going to be up in a week or 2. When it's not about the Benjamins and it's serious, people can get off their butts and do something. This thing that they're talking months, just think about that for a minute. Months. Even at the pace it's going right now, months is way too long. So I urge you again, guys, if you got the money, get supplies. If you don't got the money, get what you can on your... If this starts to blow up more, decide what you and your family want to do for yourselves. If you don't believe what I'm showing by watching these, and these are pretty good channels and pretty good information coming out, research yourself, guys, and then share with me. Hey, I'd love to know anything you guys dig up. So we're going to watch a few more minutes of this.
We received the sequence from the Chinese government, and we worked overnight, and the next day we had designed a vaccine. We immediately put that vaccine into manufacture, which is the stage that it's currently in, and we...
Overnight? OMG. And that's if they got the right genomes and the right stuff, that they were given the right stuff. You know, this is coming from somebody that's not so trustworthy, even though they're in a heap of trouble right now. I've watched a couple tubers that I respect that have been done some research on this, and I have yet, like they said, to see our teams coming up and saying what this really is, or to making, you know, gene counts and deciphering what's really going on here, guys, with this stuff. Back to the show.
Hope that that will be entering into human clinical trials by early summer. That timeline is absolutely unprecedented in vaccine development.
In the UK, the repatriation flight will land at RAF Bryce.
And I want to bring it up one more time. Our president signed stuff, the right to try. So if you or your family get to that point to where you feel it's no other way but to try this, once they get this done, then they need to be giving it out to people on a voluntary basis. We can't wait weeks or months. If people start getting more ill, and it starts going click, 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 the numbers. Let's stop it before it gets to be click, 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 click. Yeah, it's scary.
Norton in Oxfordshire tomorrow morning. Then the British nationals will be driven 170 miles by coach to Arrow Park Hospital on the Wirral, where they'll spend the next 14 days in quarantine, housed in former staff accommodation blocks. Fergus Walsh, BBC News.
Well, our health correspondent Dominic Hughes is outside Arrow Park Hospital now. It's going to be a long journey for them when they finally leave Wuhan. What happens when they get there?
Well, those 150 patients, people, Sophie, who will be travelling here to Arrow Park Hospital in the Wirral in northwest England from RAF Bryce Norton. They'll be accompanied by public health officials on that journey. But why are they coming here? Well, I think the truth of it is this has all been arranged very much at the last minute. This is somewhere that had enough accommodation to house those 150 people for 14 days. And of course, while they're here, should they need it, they will be cared for and monitored by doctors and nurses who work here at Arrow Park Hospital. But there's lots of things we don't know. While they're here, will they be kept isolated in their own individual rooms, or will they be treated as one big group? Will they be able to socialise together? Will they eat together? What happens if one of them falls ill during that period? What happens to the rest of them? So lots of things we don't know the answers to. But one thought about that raising of the threat level from low to moderate by the chief medical officers of the UK. They say it's not so much the threat to individuals has changed, but that the government needs to be prepared for all eventualities. Back to you, Dominic.
And he's hitting on some good questions. What are they doing? And they need to release this stuff. We as the people, we have the right to know what the heck they're doing. They have a responsibility to tell us. Just like the lab up there in Canada, not a word, nothing about all this. You know, I've tried to call a couple places up there, and I can't get through, or no answers, or they hang up the phone. I'm going to record some of that in the next few days, guys.
Thank you. Kilometre Far Eastern border with China to stop the spread of the coronavirus. Other countries have suspended flights to...
I had some watchers asking me about Russia and about NK and things. Here's a little bit supposed to be on that. We'll see. I'm watching this myself.
China halted road traffic and stopped Chinese citizens entering. The number of people who have died has now jumped to 170, all of them in China. Nearly 8,000 people have confirmed infections. A flight to return about 200 British nationals to the UK from virus-hit Wuhan has been unable to take off as planned. Robin Brandt has more from Shanghai.
Today was supposed to be the day they got out and away from this. The death toll and the number infected continues to rise here in China. The city of Wuhan is the epicenter of the outbreak. But Britons are still stuck there because of bureaucracy.
We were really worried about the reports of younger and younger children becoming sick. And at the time they said it was fine, but when I received a call the next day, they said that only I could go and my son would have to stay. And which obviously was very devastating to hear.
English teacher Natalie's son can't go because he has a Chinese passport. Chris Hill has a similar problem. His wife and daughter have dual nationality.
Would you be willing to leave your family behind to go to safety? It's a very hard and moral question, because my daughter is only 4 years old. So it's a very hard choice to make.
Other countries have got their people out. Japan and the US were the first of several planned flights. India and Australia are among those planning others. The Foreign Office said it is working urgently to resolve the problem for British citizens, with talks at very senior levels. Quarantine on a military base or an NHS facility back in the UK awaits. Fear about the virus spreading has caused scenes like this across all of China. even in Hong Kong, which has now all but cut itself off from the mainland.
I queued for an hour and 10 minutes and bought 2 boxes of masks. We were running out of them at home. Hong Kong should act like Taiwan to stop exporting masks and keep them for the locals so that we don't have to queue for hours.
More cases are being reported around the world. In Italy, passengers on a cruise ship are being held on board because of 2 suspected cases among them. But the head of the World Health Organization had nothing but praise for China's efforts.
I will praise China again and again because its actions
I don't know how you guys feel about that, but I have to tell you, they're trying, but you know what? They also are not. They also have not come out and admitted what they did with their 2 people that stole the virus out of Canada. They're not. You guys ain't gonna hear much of that. There's only about 3 or 4 of us that know that what the details are in that, and we've researched it, and that's pretty much what happened, guys. So they were working on bioweapon up there in Canada, and it got stolen. I'm not going to go into the details right this second, but you can watch several of my previous videos. Pop over and check BP Earthwatch. He did a long one on it. Here's the last few minutes. He's supposed to talk about Russia too. We'll see.
actually help in reducing the spread of coronavirus to other countries.
Still, though, drastic measures are being taken here, far away from the worst affected area, to try to halt the spread. Office workers in buildings over 1,000 kilometres away are having their temperatures checked daily.
Let's get you the latest on some of the developments today. I'm joined by Sarah Rainsford in Moscow. Mark Lowen is in Rome. Sarah, first, the closing of that border is no small feat.
No, that's right. It's an extremely long border, more than 4,000 kilometres in the far east of Russia with China. And we now know that the Prime Minister has essentially ordered that key crossing points for pedestrian and for traffic across that border will be closed. We also know that all passenger trains, Moscow-Beijing passenger trains and freight trains will be non-stop between those 2 cities. So no people getting on or off on the way. There are other measures that have been taken as well. The foreign ministers announced that they will stop issuing electronic visas for Chinese tourists to come to Russia. They're also asking Russian citizens in China to register with the Russian embassy there so that it's clear where they are if there's a decision made at some point to evacuate them. For the moment, flights are still flying, but for example, here in Moscow, where there are Chinese tourists in hotels, there are now medics going to those hotels, checking tourists before they head out to the sites here to check that there's no symptoms, no signs of anyone having caught the virus and potentially therefore spreading it. So a whole series of measures in place, although the authorities here making it quite clear that there's no reason for panic. There are certainly no cases confirmed of the coronavirus here in Russia yet, but the Deputy Prime Minister has said that they are likely to happen. So those measures are now being put in place to prevent, as far as possible, the virus spreading here.
You know, that's just, I keep hearing that story. Oh, we're like using thermal scans and other things. Personally, unless you've got some kind of test where you draw blood work, guys. Maybe saliva, I don't know about that one. But definitely blood work, and you're running it and it's a positive or a negative. And even then, if it's in an incubation period, it might not show up yet. Plus, we talked about 5 days. It could be on any item. I mean, these guys are sanitizing stuff, but that don't mean... What about that little wrapper way over here? Or that Kleenex that fell underneath the chair that nobody's seen and stuff, you know, or whatever. Half a candy bar a guy couldn't finish and dropped out of his mouth, you know? So let's see what Rome has to say.
Let's go to Rome now. And Mark Lowen, we're talking about a cruise ship with, what, 6,000 passengers on board?
Yeah, indeed, Philippa. It is called the Costa Smeralda, and it has 6,000 passengers on board. It is now in port in Civitavecchia, which is about an hour away from Rome, but the passengers are not being allowed to disembark because there is a couple on board from Macau, and the woman, 54 years old, has had a fever and other potential respiratory problems that could suggest that she has contracted coronavirus. She is now in isolation. Tests are being carried out on her, and the results are expected later on today. The couple had flown from Hong Kong on the 25th of January to join the cruise ship, which then made its way to Marseille, Barcelona, Mallorca, and back here to Italy. It was due to go further north in Italy, but it's being kept in Civitavecchia while those tests are ongoing. We are told from the cruise company that there is no panic on board. Everybody's been told and made aware of the situation, but of course it is being held there in the port until the results of those
Where's
tests
the film? Where's the film off
Mark
the ship?
in Rome and Sarah in Moscow, thanks very much for those live updates.
Where's the films off the ship? No panic. If I was on that ship, I would be worried. I would be worried. Okay, that's what I'm going to say about that situation. Now, Marfugel came up with some ideas. Smart guy over there, Marfugel News, Marfugel TV. Hey, Marf! Healthcare sucks. Salute, Marfugel and family. I'm quoting this. He talked about movies coming up in the future. Well, Death Ship 2020. Or my one I'm pushing right now, Death Bowl 2020, where the plague became out of control. Guys, it's just nuts to me to think a million people, or whatever, how many ever, 100,000, 200,000, whatever is going to be going to Super Bowl, staying in hotels, traveling, and etc. Between that and their holiday thing for the Chinese, this is the perfect storm, guys. Yes, perfect storm. This is the combination of 12 monkeys, etc. I'm not kidding, guys. I could name them off. There's so many video games and so many movies out there that tell the truth on this. What could happen and what did happen. I could give you a list of video games I personally have tried that end up with bad scenarios from these things. So with this, I'm bringing you stuff as much as I can find, as I find it. Anything you got to share, share. And if I can run with it, I'll run with it. If anybody has connections over there or can get me, I needed somebody to authorize me on WeChat. I signed up for WeChat, and if you get to me on the on my email, I can send it to you, a copy of this little thing that has to be scanned by your phone, and you can add me for WeChat, and I can do WeChats and try to get some of that stuff live to share with you guys from people who are trapped. I'm trying. And with that, remember, healthcare sucks! Over and out, my friends. Stay tough. Be brave. Be wise. And healthcare out.